All right, so good evening, everyone. Am I audible? Yes, everyone, am I audible? So there was some technical issue. Now we have sorted, right? So there was some technical issue. Now we have sorted. A very good evening to all of you. Yes, guys, a very good evening. Yes, everyone, a very good evening. Can we start? So how is the audio visual, guys? How is the audio visual? Yes. How is the audio visual? Guys, how is the audio visual? Yes. Good evening, everyone. Good evening, everyone. Good evening. How is the audio visual? Can we go ahead? All right. So today I'm going to talk about a very important topic. And the topic is zoonotic diseases of public health importance. And this is very important topic, right? And first disease which I'm going to talk about is rabies, the most important, right? So this is most important zoonotic disease. This is most important zoonotic disease. There are many confusions also about the guidelines, about the management. I'm going to also address about those, right? So can I start? Yes, guys, boarding started. Can I start? Before I start, can I see few happy faces in the chat box? Guys, can I see your happy faces in the chat box? Yes. Can I see some happy faces in the chat box before I start? All right then. So coming to rabies, coming to rabies, and first I'm going to take is category of animal bite wound management. Category of animal bite wound management. Guys, this is very important topic, and there are total 3 categories. Category 1, 2, category 3. Okay, so many happy faces, guys. Okay, so there are 3 categories, category 1, 2 and 3. So what is category 1? Category 1 means just you are just touching or feeding. You are just touching or feeding animal. This is category 1. And if the animal is licking on intact skin, if animal is licking on intact skin, so touching or lick by animal on the intact skin is category 1. Now what is category 2? Category 2 is minor scratches. Category 2 is minor scratches, or you can say abrasion without bleeding, right? So there is abrasion but without bleeding. So abrasion without bleeding is category 2. But if any of the case you are seeing where there is a transdermal bite, even a single transdermal bite, or it can be multiple transdermal bites, right? A single or multiple, where the bleeding is there, it is category 3. Now, if I talk about, for example, you are going and for example, someone is going and there is some lesion, some ulcer in the foot, or you can say some abrasion, already कोई चोट लगी है पहले से, right? And now the dog is coming and licking the feet of that person. Now this is category 3. So lick on broken skin, right? For example, someone got injury in the foot and now the dog came and dog is licking the feet which is injured. This is category 3. And third is lick on mucous membrane. Right? So these are category 1, 2 and category 3. Now guys, what about the management? How would you manage these categories? Category 1, you only need washing. Category 1, you only need washing. Category 2, with washing, you also need vaccine. With washing, you also need vaccine. And category 3 is washing, vaccine, and along with washing, vaccine, now the patient needs immunoglobulin also, right? The patient also needs immunoglobulin. So category 1, 2, 3, their management done, sorted. Can I go ahead? Done, everyone? Can I go ahead? Yes, guys, can I go ahead? Guys, can I go ahead? Now, I hope this slide is clear. There should be no confusion. This can be asked as the history in your question, right? This can be asked. Now guys, coming to wound management. Now, number 1 point regarding wound management is, number 1, you have to do washing. First very important thing regarding wound management is washing. How should you wash? For 15 minutes using a soap under running water. So basically we ask the patient to open the tap, right? As you can see here in this image, the tap is open and with soap we are asking to wash it for 15 minutes under the running water. Now after washing, we ask for a antiseptic. Which one? Povidone iodine. Antiseptic, right? Now third is, now suppose there is a wound and we need to do a suturing. We need to close the wound. So should we do suturing? Yes, guys, can I get your answer in the comment box? So guys, would you like to please comment in the answer? Would you like to please comment the answers in the chat box, right? So would you suggest suturing? Yes, guys, what about suturing? It should be avoided. It should be avoided. It should be avoided, right? And if cannot, then delay. If cannot, then delay the suturing. Do not suture immediately. And like other wounds, there is a classic management. Antibiotics plus tetanus prophylaxis. Antibiotics plus tetanus prophylaxis is needed as per the guidelines. Now, Guys, this much information is given in the government of India guidelines. But which antibiotic is used is not given in the government of India guidelines. They have not mentioned which antibiotics should be given. But this question came in INICET. This question came is INICET, right? INICET 23, right? This question was asked. Which antibiotic should be given? Yes, any guy, anyone? What is the answer? Very good, Dr. Divya Bache, very good. So the answer is amoxiclave, right? In Government of India guidelines, they have not mentioned this, but the CDC mentions that amoxiclave should be given, right? Sorted, but your wound management is sorted. So one student is asking, sir, actually, what's the reason for not suturing? And the reason, beta, is suppose, so see, guys, suppose, so there is a limb, there is a dog bite, a limb where there is a dog, right? A limb where there is a dog bite. Now, around the wound, there is the saliva. Around the wound, there is the saliva. We are asking to wash it under running water to remove it. Suppose 0.1%, the Dettol is also saying 99.9% they are going to remove the germs. Suppose 0.1% chances the microbe is there. We are asking to use antiseptic to remove it. Now, we are saying do not suture, because suppose if there is any virus over there, we are deep inoculating, right? That is the reason we want to avoid the suturing. We want to avoid the suturing. And second reason is, which I am going to tell you regarding immunoglobulin. Now guys, the next is immunoglobulin. So if I talk about immunoglobulin, I want to discuss this immunoglobulin under two categories, right? Number one is whom should we give immunoglobulin? Guys, any answer? We have just discussed. Yes, but any answer? I just told you in previous slide. Whom should we give immunoglobulin? So the guidelines say all category 3. All category 3 should get immunoglobulin. And there is only a scenario where category 2 we can also give to category 2, and the reason is if the category 2 is immunocompromised. So if you have a category 2 patient who is immunocompromised, HIV positive, on steroid therapy, anything, if it is a category 2 but immunocompromised, you need to give immunoglobulins, right? You need to give immunoglobulins. Now bache, there are two types of immunoglobulins. There are two types of immunoglobulin which are available in Indian markets right now. These two types are, yes guys, any guess? This is equine immunoglobulins and human immunoglobulin. The dose for equine is 40 international unit per kg, and for the human is 20 international unit per kg, and the human is 20 international unit per kg. The reason here is because the human immunoglobulins, they have more T-half. That is why we are giving half the dose. Now guys, a very important administration. How you are going to administer the immunoglobulin, that is important. Number 1 point, bring it to the room temperature. So immunoglobulins are there in 2 to 8 degrees Celsius. Before administering, it should be brought to room temperature. It is given only once. And not given, there is no point of giving immunoglobulin after 7 days. So after 7 days, there is no point of giving, right? This should be given at wound site. At wound site, I'm going to give the immunoglobulin to the patient. Now, what if anatomically it is not possible? Now, suppose there is a 100 kg patient. I'm going to give human immunoglobulins. So I need 2000 international unit, and there is only small bite in the toe. So anatomically not possible. If anatomically not possible, then give intramuscular at nearest site. Give intramuscular at nearest site. Can I give IV? No, never IV. This is never IV. This is never given IV. Right? This is never given IV. Right? Guys, this information regarding administration was asked in your INICET 22. So 2 questions back to back in INICET exam. 2 question. Yes, Dr. Rachna, but only once in lifetime. Only once in lifetime. Right? So guys, from this slide, 2 questions back to back in INICET 22, 23. Sorted? Can I go ahead, guys? Can I go ahead? Yes, can I get quick thumbs up in your chat box? Guys, done? Any doubt in this? Any doubt? No. So we have discussed wound, we have discussed immunoglobulins. Now it's time to discuss intradermal route and intramuscular route of vaccines. Now bacho, if I talk about vaccine, so quickly, indication, can you tell me about indication as post-exposure prophylaxis? What is the indication as post-exposure prophylaxis? Guys, quickly. Number 1, all category 1 and category 2. I'm sorry. Category 2 and category 3. Tongue slip. I'm sorry. All category 2 and category 3 should get vaccine, irrespective of age, pregnancy, lactating, anything. Right? Now we have 2 available regimes. One is updated Thai Red Cross, and another is Essence regime. So bachcho, updated Thai Red Cross is only intradermal regime, not intramuscular. Right? In India, currently, these 2 regimes are used. These 2 regimes are recommended by Government of India. Right? There is another regime, Zagreb regime, not used currently. Right? Under Government of India guidelines. So guys, if I talk about this intradermal route, 4 doses are given. 4 doses are given at 2 sites. Right? So 1, 2. Right? So 4 times this is given when? Okay. 0, 3, 7, 14, 28 and 28. If I am giving this updated Thai Red Cross, I don't give vaccine on 14th. Right? I do not give vaccine on 14th. Right? So 2 injections I am giving. Guys, 2 injections I am giving. Then 2, then 2, then 0 and 2. That is why this is also known as 22202 regime. That is why this is known as 22202 regime. Now, if I talk about your intramuscular regime, Essence regime, it is 0, 3, 7, 14, 28. So here we are giving 5 doses at one site. 5 doses at one site. Right? So total 8 doses are given total 8 doses are given in intradermal and total 5 doses are given in intramuscular. So can I also say 1 1 1 1 1? So this regime is also known as 1 1 1 1 1. Now guys, this should be given at deltoid region. This should be given at deltoid region, right? As you can see here, on the deltoid region we are giving intradermal. Whenever we give intradermal, there is a bleb. There is a bleb, right? If you attended my vaccines class, I tell you there, right? The reason why bleb is there and what is the indication here, right? Now, this is given at deltoid 0.1 ml. 0.1 ml, whereas intramuscular is given 0.5 ml or sometimes 1 ml given as per the manufacturer, right? 0.1 ml where? At deltoid. At deltoid. Now, if you have a child, you can also give anterolateral thigh if you have a child, right? If the patient is a child, anterolateral thigh may be given. So here I am writing child. Now, whatever I want to tell you about this point is, it is never given on gluteal. Never given on gluteal. This is the important point. Even if intramuscular you are giving, never given on gluteal region. Right? Now bachcho, look here. Yes, I want to draw your attention here. Yes, guys, I want to draw your attention here. Look here. See? Okay, look here. So this is the updated Thai Red Cross, 8 doses in 4 visits, and right now first day 0, yes, given 2 injections, on 3rd 2 injection, on 7th 2, and on 18th again 2. So this is the bleb which will be there, right? And now coming to SN. SN is the intramuscular. Some students, they ask me, sir, Thai Red Cross also intramuscular? Never. Thai Red Cross is never intramuscular. It is always intradermal, right? So 1 injection, 1, 1, 1, and 1 injection here, right? 1 injection here. Now coming to, there is an important switching from intramuscular to intradermal. Now suppose you have given first dose to a patient intramuscular. Now the patient is saying, please give me second dose intradermal. Not. Switching from intramuscular to intradermal, not recommended. Not recommended. Now switching brand, this is also not recommended, right? So you cannot switch the brand and or intradermal, intramuscular. This is routinely not recommended, right? Sorted? Can I go ahead? Yes, guys. Now the biggest confusion ever: pre-exposure, re-exposure, pre-exposure, re-exposure, right? Now coming to re-exposure, let us discuss re-exposure first. If less than 3 months, if you have a patient who is again bitten by a stray dog or cat or monkey within 3 months, right? There is nothing, no need to do anything, just wound wash. Yes, Abhishek, vaccine brand. Which brand you want me to discuss here, Abhishek? Which brand you want me to discuss here? Vaccine brand only, right? Only wound washing. If it is more than 3 months, now if it is more than 3 months, then 0, 3, 2 doses. right? 0, 3, 2 doses. One site, if intradermal. Even if you are giving intradermal, then you do not give 2 injections, only 1 injection also in case of intradermal, right? One site. And yes, someone was asking me, immunoglobulin not needed, only given once in life. Immunoglobulins only given once in life, right? So 0, 3 days, yes, obviously, bache ARV is given 0 and 3 days. Vaccine, rabies vaccine is given on 2 days, right? Sorted. Now coming to pre-exposure prophylaxis. Pre-exposure prophylaxis, whom should we give pre-exposure prophylaxis? The lab staff who is handling sample for the rabies, clinicians, animal handlers, dog catchers. I want to tell you one important thing here, that Indian Academy of Pediatrics, IAP recommend pre-exposure prophylaxis for all children. Indian Academy of Pediatrics recommend pre-exposure for all children. Okay, what is the schedule? 0, 7 day and a booster. Booster when? 21 or 28 days. A booster 21 or 28 days. Yes, Dr. Rachna, veterinary doctors also. Now after giving this, we have to check titer every 6 months. If titer is less than 0.5, then give booster again. Clinician, बच्चे, human clinician, doctors, right? Those who are specially looking for cases of rabies. Government of India guidelines say they should get the pre-exposure prophylaxis, right? Okay, sorted? Yes, guys, sorted? Are you there or slept? Now, this is the image which I want to show. This site can be used if it is intramuscular or intradermal. Deltoid should be used. If it is a child, anterolateral with the deltoid can be used, but never ever this area, gluteal region, right? Gluteal region, never. Now, all right, so this you are going to tell me. So I am trying to create a protocol summary of whatever we have read, right? So you are going to tell me, I want the fire in the chat box, right? I want the fire in the chat box. Yes, guys, ready? Yes, everyone ready? Ready? Can I see the fire in the chat box? All right, so you have a category 1. What you are going to do with category 1? What you are going to do with category 1? Wash. We are going to recommend wash, right? So only washing is recommended, right? Now what about category 2? What about category 2? If you have a category 2, chances are there the patient is either previously unimmunized or the patient is previously immunized. If the patient is previously unimmunized, right? So you are going to do wound wash, right? You are going to do wound wash. Better to write here wound management, because wound management, it includes what? Wound washing, it includes povidone iodine, it includes avoid suturing, it includes antibiotics, it includes tetanus, right? Now, previously unimmunized, we give vaccine. We give vaccine as post-exposure prophylaxis, right? Now coming to, okay, one more point I want to tell you here. One more point I want to tell you here. And that point is, if patient is immunocompromised, do not give intradermal. Always give intramuscular if patient is immunocompromised. If patient is immunocompromised, always give intramuscular, not intradermal, right? Okay. Now, so, and when you are going to give the vaccine, if you are giving intradermal, then 0, 3, 7, 28. If you are giving intramuscular, then 0, 3, 7, 14, 28. Sorted? Now, if the patient is a category 3, there are chances the patient is previously unimmunized. And the chances are the patient is previously immunized. If the patient is previously unimmunized, what you are going to do? You are going to wound management. You are going to do wound management. You are going to give vaccine. You are going to give immunoglobulins. You are going to give immunoglobulins. If more than 7 days, never give immunoglobulin. If more than 7 days, don't give immunoglobulin. Now coming to previously immunized. If it is less than 3 months, only washing. Or you can say wound management. If it is more than 3 months, if it is more than, and there is no such criteria like 3 months to 1 year, 3 months to 5 year, no such criteria. Government of India guidelines say there is no such criteria, right? If there is a documented proof, treat it like this, right? If it is more than 3 months, treat it like Reexposure. Treat it like Reexposure, which we have already discussed. Now coming to next one. So there is sometimes a question arises, most cost effective. This question is arising because this is a Neet PYQ. The PARK textbook says, since the dog is the major source of infection, most logical and cost effective approach is elimination of stray dogs combined with mass vaccination of the dogs. Right? Why I am telling you this? Because this is a PYQ. Previously Neet PG, this was asked. Right? Sorted? Can I go ahead? Everyone? Done? So rabies, one zoonotic infection, very important. Every year, be it Neet PG, be it INICET, be it FMGE exam, this is important. Right? Okay, so Dr. Sweetie Goyal is asking, sir, can be given gluteal site? So if the wound site is near the gluteal site, you may give. It is given in intramuscular. If it is given as intramuscular, right? It can be given, Dr. Sweetie, it can be given. Okay, Dr. Rachna, yes, remove dogs. Right? Elimination of stray or ownerless dogs combined with mass immunization. So till now we have discussed all the guidelines, we have discussed all the recent previous year questions. Okay, Vivan, only one dose. Now, bacho, I am moving to next disease, yellow fever. So, bacho, yellow fever is a zoonotic disease. It is a zoonotic disease. And also, this is a vector-borne disease. So if it is a zoonotic disease, then there must be primarily this must be infecting an animal. Which animal? Monkeys. So yellow fever is basically disease of monkeys. It is a vector-borne disease. Whenever we have a vector-borne disease, we have a vector and we have an agent. We have a vector and we have a agent. What is the vector in case of yellow fever? Guys, any guess? What is the vector? Yes, guys, Aedes. Very good, Dr. Anil. Aedes. Now, Bacho, what about agent? What is the agent in case of yellow fever? It is a flavivirus. It is a flavivirus. Now, if I talk about the incubation period, it is 3 to 6 days. It is 3 to 6 days, and 6 days is the maximum incubation period. Guys, do you have any idea where we use maximum incubation period? Isolation or quarantine? Yes, guys, any idea where we use maximum incubation period? So this is the 6 days under international health regulations. 6 days are considered. I will tell you in next slide. Now there is one term which is known as extrinsic incubation period. It means the incubation period in mosquito, right? This is 8 to 12 days. 8 to 12 days. Now coming to, I want to tell you one thing, that India is yellow fever receptive country. It is a yellow fever receptive area. Yellow fever receptive area means we do not have yellow fever in our country, but if somehow it is introduced in our country, then हमारी country में potential है that it can be the big problem for us. Why this is a receptive area? Because favorable environment, we have favorable conditions, and the vector is present, and also we have susceptible population. This can be a big problem in India. Number one reason is susceptible population. Susceptible population means our population is unimmunized, right? And in India we have favorable conditions, like we have Aedes, right? So Aedes is there. This can be a problem for us, right? Now coming to next, how this yellow fever can enter in our country. How this yellow fever can enter in our country? Either by infected person or the mosquito can come, right? From the country, from the Africa, either an infected person can come in India and transmit, and second is mosquito. For infected person, we have some rules. The rule says vaccine certificate. We will not allow anyone without vaccine certificate. And second rule says mosquito, all the airport, seaport, right? We keep Aedes aegypti index less than 1. So we keep Aedes aegypti index less than 1. Right? Now, let me summarize. So yellow fever, a zoonotic disease, mainly monkeys. Also, this is a vector-borne disease. What is the vector? Aedes. What is the agent? Flavivirus. Incubation period 3 to 6 days. Extrinsic incubation period means the incubation period in mosquitoes. After 8 to 12 days after taking the meal from an infected person, the mosquito will be infected in 8 to 12 days. Then we learned that India is a receptive yellow fever receptive area because we have susceptible population and favorable conditions, right? Now coming to the very important point about yellow fever vaccine. This yellow fever vaccine is a live attenuated vaccine. It is live attenuated vaccine. What is the dose? 0.5 ml. How it is given? Subcutaneous. What is the strain? Strain is 17D. Strain is 17D. Any contraindication? Yes, guys. What is the contraindication? Any guess? Contraindication for live attenuated vaccine is immunocompromised. Immunocompromised. Right? Now, the next point is the vaccine, the international certificate of the vaccine. This is the international certificate. This is the international certificate. Yes, Dr. Jain, also allergy to egg. Yes, very good. Very good, Dr. Jain, very good. Right? Now, international certificate, it is valid after 10 days. It is valid after 10 days and this is valid lifelong. Valid for lifelong. So, after 10 days, it is valid, and after 10 days, the certificate is valid and it is valid till lifelong. Now, bachcho, my next question is, what if there is a traveler coming in our country from endemic area, there is no vaccine certificate. No vaccine certificate, right? If no valid vaccine certificate, then what you are going to do? Hanji bachcho. So there is one human being. I told you in India the infection can be there. I'm sorry. In India the infection can be there because of infected person or a mosquito. If infected person is in our country but no valid vaccine certificate, then what you are going to do? Hanji bachcho, can I get your answer in the chat box? What you will do? Very good, Dr. Rajat. Quarantine. We will quarantine. Very good, Dr. Rachna. Very good, Dr. Arohi. Very good, bachcho. How many days? How many days? Yes. How many days? You are going to tell me how many days. We do quarantine for maximum incubation period. And what is the maximum incubation period for yellow fever? Very good, beta. Very good. It is 6 days. We are going to quarantine for 6 days. Now coming to I strategy, the full form for I strategy is eliminate yellow fever. Eliminate yellow fever. Right? Eliminate yellow fever. The strategy for the I strategy includes 3 objectives. It includes 3 objectives. Number 1, protect high risk population. Number 2, prevent international spread. And number 3 is, what is number 3? Contain outbreak rapidly. If okay, all right, so guys, I'm sorry there was some network issue. I think it's fine now, right? So we are going to next topic. The next disease is leptospirosis. The next disease is leptospirosis, right? Now, leptospirosis, last year, Neet PG, the question was there. Now, coming to leptospirosis, what is the agent? Agent for leptospirosis is leptospira. Agent for leptospirosis is leptospira. Yes, guys, we are back. We are back, right? So, what is the source, guys? What is? I will tell you. I will tell you. Very important point about leptospirosis, that the source is the urine of infected animal. The urine of infected animal. Incubation period 4 to 20 days. So guys, what happens, right? So this is a rat. Rat urine contains spirochetes, leptospira, and now this rat urine, it infects the environment. Now, the important point here is that leptospirosis, the spread, the outbreak of leptospirosis needs heavy rainfall, heavy rainfall or floods. So keyword for leptospira is urine of animal, heavy rainfall, flood, and if there are rats, right? So mainly rats. Now, what is the mode of transmission? Number one is direct contact. So this rat sheds spirochetes. The water body gets infected. Then this goes to the other animals, cattle, dogs. Now they also secrete leptospira spirochetes in their urine, and there is flood, heavy rainfall. The man can get the infection. The man gets infection by three ways. Number one is coming in direct contact with animals. Second is indirect. There are abrasions, some cut in the feet. Now the soil is infected, the water is infected, the man is coming in contact with the soil and the water which is infected. In direct contact, here the man is coming in direct contact with the good. Then we have droplet infection, then we have droplet infections. Now, next is I'm sorry, this is clinical features. I'm sorry, this is clinical feature. If I talk about the clinical feature of leptospirosis, there are two phases. One is anicteric, another is icteric. Anicteric phase means fever with chills. Fever with chills. Icteric phase means jaundice. Icteric phase means jaundice. And then we have Weil's disease, where there is renal failure, hepatic failure. These renal and hepatic failure along with leptospirosis, this becomes, right? Now, coming to the control, how you are going to manage, the most important thing is rodent control. Rodent control. So around 3 years back in 2021, in some of the parts of southern India, there was outbreak of leptospirosis, right? So whenever there is an outbreak of leptospirosis, whenever there are floods, rodent control is very important. Rodent control is very important, right? Along with rodent control, we give prophylaxis, doxycycline as prophylaxis, right? Even you won't believe this, doxycycline is given as mass. This is given to the whole area. Everyone doxycycline is given. So this is leptospirosis, a very important disease, a very important zoonotic disease. Next, I'm going to brucellosis. Right? Now, this brucellosis is spread by, the agent is brucella, and there are 4 types of brucella. You are going to read this in detail in your microbiology. So what is the reservoir of brucella? The cattle, sheeps, goat, cattle, sheep, goat, right? cattle, sheep, goat, they are reservoir. Yes, we want treatment. Drug of choice here is penicillin. Penicillin. Yes, penicillin. Right? Yes, Dr. Anil, doxy is not given to pregnant and child. Now, coming to brucellosis. So, in brucellosis, the reservoir is cattle, sheep, and goat. These are the reservoirs. If I talk about the host factors, then farmers, butchers, basically adult males are more at risk. Basically adult males, right? So the cattle, basically the cattle are infected and adult males are at more risk. The mode of transmission, number one is direct contact with infected material. What is the infected material? Yes guys, what is the infected material here? It can be the milk, urine, placenta, vaginal secretions. Milk, urine, placenta, vaginal secretion of infected animal. Right? Now coming to foodborne. If someone is consuming raw milk, and airborne, if this dust, if the dust is infected with the infected material and the person is breathing there, it can be airborne, right? It can be airborne. Now bachcho, control measures, this is a previous year question, not asked recently, but a few years back this was asked. How you are going to control brucellosis? Animal. So there is one strategy used for brucellosis, that is test and slaughter. Test and slaughter. What is test and slaughter? If the animal is tested positive, then the animal need to be slaughtered. That is the way to control it. For this, the farmer gets the compensation from the government. Next, you can vaccinate the cattle. And keeping hygienic measures, right? Where you are keeping animals, if you keep hygienic, we can control it. Now coming to control measures in human, guys, any guess? Can you write in the chat box how you are going to control brucellosis in animals? Any guess? So there are basically 4 points. For controlling brucellosis. Number one is early diagnosis and treatment. Which antibiotic is used? Tetracycline. And always consume pasteurized milk. Do not consume raw milk. We ask the farmers to have protective measures and vaccination. Those who are in direct contact with these animals, they also can get the vaccine, right? So these are the control measures for brucellosis. Right? Now coming to Crimean Congo fever. Right? Guys, are you there? Are you awake? Yes, are you awake? All right. So these are very important zoonotic diseases. Very important. I am discussing all the important public health aspects. CCHF, this was your Neet 21 question. Right? 21 or 22, I guess. CCHF was there. I'll tell you what was the question. Now, but your reservoir for this Crimean Congo hemorrhagic fever, the reservoir is hard tick. Hard tick. Right? So how the disease can be transmitted? You see, this is the hard tick. How the disease can be transmitted? Number one, the tick bite. Number one, the tick bite. This tick can infect the animal also, right? So coming in contact with infected animal. And the third is human to human transmission. The third is human to human transmission, right? This can be transmitted in only 3 ways. Now, the symptoms, they include fever, headache, body pain, jaundice, thrombocytopenia. Thrombocytopenia, right? Thrombocytopenia. Now, how you can prevent? So guys, if the disease is transmitting by the tick bite, so if the farmer is applying, yes, Dr. Surbi, joint pain. If the farmer is applying insecticide, DEET, right? This can prevent. The second is avoid contact with body fluids of animal. The treatment is, majority of the treatment is supportive. The treatment is supportive. We can give ribavirin. Antiviral ribavirin can be given. So this is Crimean Congo hemorrhagic fever. Right? So the question was, which of the disease is there in India? So the question was like this: the disease which is present in India, endogenously spread in India. This was the previous year question, guys. This CCHF is there in the majority of this CCHF is majority seen in Gujarat area, right? Even in 2023, we get one case. We got one case in 2023, right? Now, coming to the next disease, scrub typhus. Yes, Gujarat, Rajasthan. Yes, Surabhi, good. Now coming to scrub typhus. This scrub typhus, INICET 23. 2 questions were there on scrub typhus. Right? Now, what is the agent in case of scrub typhus? Is Rickettsia susuga mushi. What is the vector? Here? Guys, it is a mite. But I want to tell you that adult mite does not, yes, very good bache, better I should write trombiculid mite. Good. Trombiculid mite. The adult mite does not spread, right? Actually, it is the larva, this one, right? This is the trombiculid mite and this is the adult. Trombiculid mite. So, in the vector, I want to tell you that adult mite does not spread, right? It is only larva. only larva which spreads. And also a very important point, trans-ovarian transmission is seen. Trans-ovarian transmission is seen in case of this, right? Now coming to mode, right? The mode is only the bite. Mode is bite. And where it is biting, there is a black ishar. There is black ishar. Also, patient will have fever, chills, headache, and a very, very important point which will help you in diagnosing lymphadenopathy. So the key features are black ishar, lymphadenopathy. So this is a punched out lesion. Black ishar is a punched out lesion, right? And this black ishar tells us about the site of bite. It tells us about the site of bite. Yes, this tells us about the site of bite. For if I talk about the prophylaxis for scrub typhus, again it is recommended protective measures. If someone is going in the field or forest, protective measures. And if I talk about treatment, then tetracycline. So guys, first of all, thank you for your patience, right? Thank you for your patience. I have tried to compile all the important zoonotic diseases which are very important. Rabies, very, very ultra important. Yellow fever, leptospirosis, all of these diseases are very, very important, right? Yes, tetracycline can be given. Thank you everyone. I hope you enjoyed. Although there was a lag, right? So thank you guys. Do like, right? I would love to know about the comments. I would love to read your comment. Do subscribe, and also on our DAMS Delhi Telegram, right? Do subscribe. Thank you everyone. Thank you so much everyone, right? Thank you so much everyone. Dr. Nitya, clinical presentation. Is very similar. The CCHF, the clinical presentation is very similar to this dengue. The clinical presentation is very similar to the dengue, and clinically it is very tough to differentiate both of them. However, jaundice, is not seen very frequently in dengue, right? This is the one point where you can differentiate CCHF from dengue. Yes, most of these diseases they have similar presentation, and ELISA can be done to differentiate the CCHF and dengue. And one more doubt is coming here, sir. Incubation period, guys. Incubation period, what is incubation period? Incubation period is from the entry of organism to sign and symptom, right? Entry of organism to sign and symptom. What is period of infectivity, or you can say communicable period, where the disease can be transmitted, this is infectivity, right? Okay, sir, among emerging infection which are okay, among emerging infection which are prevalent in India. See, some of the, if I talk about the emerging infection, there was COVID. COVID was there, right? And if I talk about the Zika and Nipah, they are not seen much in India, right? Okay, so Nitya is asking about leptospirosis. We give only one dose for leptospirosis. Doxycycline, one dose is given, right? The doxycycline, one dose is given. A single dose is given. Chalo. Thank you, bacho. Thank you so much. Right? Don't forget, don't forget to like, right? And do share us. Thank you so much. Thank you so much, everyone.